Black Doctors podcast. What you just heard is a reel posted by Dr. Meena Singh. She is a dermatologist. There's a couple other dermatologists, Dr. Corey Hartman, that were involved in putting this incredible display together today. The Black dermatologist, representative of that small percentage of dermatologists that are Black or African American, they worked together. They went to their national conference and had to fight against this policy that was proposed to sunset diversity, equity, and inclusion effort with the American Academy of Dermatologists. This was brought to my attention initially by Dr. Spidinsky and Dr. Robinson, two dermatologists that were posting very vehemently and avidly about this proposal. They literally put their careers on the line, their reputations, everything on the line, and fearlessly posted about this on social media. They posted from different news sources and news media, and it was an all-on assault against these proud Black dermatologists. And according to this Instagram post, they were able to win, and this amendment did not go through to sunset the DEI policies. Hopefully I don't get a copyright strike for the sound that was in the background of that audio clip. But a great day for the dermatologist. You know, it just goes to show where we're headed and the things that we're going to have to come up against as we engage in this field of medicine. Hats off to those folks that are holding it down. Also, tomorrow, I'm recording this quickly, kind of the day before I post this episode, but it is match week. So fourth year medical students across the country are going to get that email that confirms that they have successfully matched. Some will get the email that they are going to enter the SOAP process, or whatever they call it these days, where you have to kind of scramble to get into a residency spot. We wish you all the best. Good luck. Our prayers, hopes, all that are with you. Good vibes. And we're excited to see all of your success. If you are somebody that finds yourself in a bit of trouble, you need some extra help, or you're scrambling to try to find a program, definitely reach out. We have a pretty vocal, pretty active community on social media. I know Twitter has been used a lot in the past. Reach out to people at these different programs and, reach out to me. I'm the anesthesiologist and have, some connections, not the most, because I'm not quite in academic medicine anymore, or not involved specifically with the residency program, but happy to help in any way possible if it's connecting people. I've connected people in the past for different specialties. So congratulations in advance. So excited to see where you all are matching at the end of this week. Last week, we started a conversation with Dr. Yeboa. She is a gastroenterologist, an incredible person. We will talk about the field of gastroenterology. March is Colorectal Cancer Awareness Month, and we spend the rest of this episode talking about healthcare disparities in colorectal cancer. Why do they exist? What can we do to change this narrative? What can we do to support and protect our loved ones? If you're not already, follow Dr. Yeboa on social media. Her links will be in the show notes, or you can look her up at Adjoa Anyane-Yeboa. That's AJOANKETIAA. Again, that will be in the show notes. Also, while you're at it, follow Black in Gastro, American Society of Black Gastroenterologists and Hepatologists. It's their nonprofit organization. They actually have a national meeting coming up. It's going to be in DC, and May 17th at the Hamilton. They're going to have this Bustin' a Gut, little on-brand kind of comedy show. And they had one in Chicago. I wasn't able to make it because I was working, but it looked like a really good time. I know Dr. Ed McDonald was involved in one in Chicago, and they had incredible entertainment, some comedians, and it was all kind of focused on awareness of GI health and mentorship and all those good things that we support here on the Black Doctors podcast. So we're going to jump back into this conversation with Dr. Yeboa and pick up where we left off from last week. Our next topic is healthcare disparities in Black Americans and Black people with colon cancer, right? So we saw Will Smith got his colonoscopy. But in your practice, what do you see with regards to healthcare disparities, and why is this disproportionately affecting Black people?
Yeah. So, nationally and across many states and in Boston as well, so Black people have high rates of colon cancer, new cases, and death from colon cancer. So in Massachusetts and in Boston, it's number one. Across the nation, Black people have the second highest rates, where they used to be the highest rates, but now American Indian, Alaska Native individuals have the highest rates in the past couple of years. And actually, some of the work that I do is around colon cancer screening in Black individuals, working in predominantly Black community health centers and working on screening. And maybe that's why I love my job. It's because it's something I'm very passionate about. So there's multiple reasons, and it's multifactorial for why we see high rates of colon cancer in Black individuals. And before I go there too, the American Cancer Society actually put out a report just last week or so, and last week being in January. So in January, that now colon cancer is the leading cause of death in men under 50, cancer death in men under 50. Wow. And the second leading cause of cancer death in women under 50. And so we're seeing a stark rise in young people getting colon cancer. And so we don't really know exactly why. Some of the traditional risk factors, like what you're eating, smoking, not exercising, not being physically active, those are some of our what we call modifiable risk factors. Maybe there's a contribution of family history playing a role, where if somebody in your family, families, we don't talk enough about our medical history. Even when I asked my mom about my cousin with lupus, my mom was like, I can't believe you asked her about her lupus. It's like we just don't talk about our medical histories enough. And so if somebody in your family has something, you might not know that impacts you and that you need to be screened earlier. And so I think there's a lot of different factors that could be playing a role. There's also bias, right? In terms of who's getting screened, who's not getting screened, even across the continuum, who we're referring for care, who we're not referring for care. And so there's a lot of different factors that play a role. I know I'm jumping all over the place, but even when we think about like social determinants, and we think about the social determinants of health and how upstream factors like where people live, access to medical facilities, coverage, provider bias, all of those things impact whether or not people are getting screened, whether they have access to screening, whether we're recommending screening to them. And so it's a multifactorial issue that even over all of these decades, we still have not been able to rectify.
So, and man, I'm digging into everything I learned from med school. What's the big deal with screening? Everybody, because I can't keep track of, I know I did my family medicine rotation. There's like the screening guidelines. It was like 40 or 50, and then 40. And some people it's like, what's the big deal?
Let's talk about it. And I think that's the thing that's confusing, because to me, it's like, the guidelines, but they change. How do you stay up with them? And so historically, everybody was supposed to be screened at age 50. Due to the rising number of new cases of colon cancer in younger folks, the U.S. Preventive Services Task Force changed their guidelines in May of 2021 to say that everybody should be screened starting at age 45. So everybody, regardless of anything, should be screened at age 45. But if somebody in your family, if a first-degree relative has colon cancer, then you should be screened at age 40 or 10 years earlier than they were diagnosed. And so if a relative was diagnosed at age 40, or let's say at age 42, then you should be screened at age 32. And that's the piece that people don't really know about. I think another thing with screening too, because you talked about colonoscopy earlier, is, people think of colonoscopy only. But there's so many other screening tests and so many other options and tests that you can do at home as well. And so in my view, the best test is the one that gets done. And it's the one that is the most convenient and easiest for the patient to do.
That was so clear. Oh my God.
Thanks.
It's almost like you're a gastroenterologist.
I've given that spiel before.
So what's the big deal with 10? Well, first, let's talk about social determinants, because so now the task force says we should screen at 45 or 10 years before. From what I understand now, sometimes insurance will say we won't pay for it. Is that a real issue?
So insurers should be covering at 45 for sure, especially because the USPSTF recommends it. I think the question is if you're having symptoms, because some people are not 45, maybe they're 38, or, you were having some GI issues as well. If you're younger than that and you're having symptoms, you should be screened urgently. You should have a colonoscopy for further evaluation, right? And so you might be younger. And so the question is whether insurers will cover at that point too. Unfortunately, insurers are unpredictable. Sometimes they will, sometimes they won't. Sometimes there'll be cost sharing. But I think the moral of the story is whenever you have symptoms, if you're younger than 45 or even after 45, even if you've just been screened, you should get checked out.
Okay. Now, there's the types of colon cancer. There's adenocarcinoma.
Now we're going into it.
That's all I got is adenocarcinoma.
So colon cancer is typically adenocarcinoma. And so the adenocarcinoma start from the adenomas, right, which are the polyps that over time, if left in the colon and not removed over decades, could turn into cancer. And so the vast majority of colon cancers are adenocarcinoma. I think one thing that confuses people is we say colorectal cancer and we say colon cancer. It's interchangeable. The rectum is the last part of the colon. And so cancer anywhere from your rectum to your colon is technically considered colon cancer or colorectal cancer.
And the difference in catching it 10 years is if you find it in this little polyp, because I follow Earl Campbell. Do you do interventional GI?
I don't. Nope. And again,
so he has, Earl Campbell's got the videos. He finds these little polyps and he scoops them out with the scope.
Yeah.
Is that the point of?
Yeah, we all do that.
Oh.
Not just Earl Campbell. Yeah, all GIs. We do colonoscopy.
Y'all don't post the videos.
We don't post the videos. We don't have the technology Earl Campbell does to post the videos while we're doing it.
Okay.
But so that's what it is. So going in and seeing the polyps and removing them. And so I think that's the nice thing about colonoscopy, in that you can detect polyps and remove them at the same time. Whereas if you do another test, like you can do stool-based testing for screening, but if that's positive, that means that there's something in there that then might need to be removed. And so one test, a stool test, would have to be followed up with a colonoscopy. I'm not sure how much detail you want about screening.
Oh, no, that's great. And then as opposed to we didn't screen 10 years ahead, it's like 10 years down the road, now the mass is so big you can't resect it. Is that?
Yeah, sometimes if you wait too long. So especially if you're having symptoms and you're waiting and waiting and waiting.
So like constipation and
blood in the stool, abdominal pain. I've heard some people coming in only with bloating. Sometimes there's no symptoms at all, actually. And that's why screening is so important. But if you're having symptoms, don't ignore them. Blood in the stool is a common one. Get the colonoscopy, because you don't want to wait for something to progress when it could have been caught earlier. I actually had a patient just last month, 1 or 2 months ago. He was 50, came in for his first screening. A couple of years ago, he would have been right on time. Now he's a little bit late, but the guidelines just changed. He has stage 3 cancer. No symptoms. Wow. And so that's why screening is so, so, so important.
And then, I'm kind of keeping it simple. I'm a simple country anesthesiologist. If it's too advanced, then you need a colectomy. You need surgery, right?
So this might be out of my realm because I don't treat cancers, but some people will need, oncologists will do this part, but they'll need chemo, radiation, surgery. I don't know if they'll do chemo before the surgery, but it'll definitely involve surgery, probably chemo, probably radiation.
Got you. Yeah, that's crazy. I work at a cancer hospital, which makes sense now. You can get screened early. They can just scoop the little thing out and boom, you go on your way. Or God forbid, you catch it late and now you got to lose part of your colon. It's oof.
Yeah. Or, you catch it too late and it can't be resected. That's the worst case scenario.
Yeah.
And so I say, I don't I don't wait for anything. If you have anything at all, talk to your family members as well. I make sure my parents are up to date. I just called last week. I'm like, wait, my dad had a 1 centimeter polyp. I'm like, wait, has it been 3 years yet? Has he gone back? My mom was like, Jill, it hasn't been 3 years yet. Because you just want to make sure that the people around you spread the word, make sure everybody's getting screened, because colon cancer is no joke.
All right. And as we know, or if you didn't know, now you do, March is Colon Cancer Awareness Month.
Yes.
So your job is, I don't do call to actions because I don't like call to actions when I'm on Instagram or on podcasts, but I'm break my rule. 1, like, subscribe, follow. Number 2, ask your family members. If you're listening to a podcast, I don't know, you're probably between the ages of 20 and 35 based on my demographics. So your parents are probably supposed to be getting screened. Maybe you're supposed to be getting screened. So have that conversation and ask, are they up to date on their screening guidelines? Are they being screened for colon cancer? Dr. Yeboa would be very happy.
Yes. Spread the word. Everybody, that's everyone's homework. Every day in March, tell one person about colon cancer and that it's preventable with screening. And more, if you like.
Fantastic. And to reiterate, this was not medical advice. We were just having a discussion.
Yes.
Oh my God. Thank you so much. That was very helpful because it really puts the scope of the issue and the healthcare disparities in context, why it's so important.
Mm-hmm.
In addition to your work in the field, you actually kind of helped launch an organization. You are a board member and co-founder of the Association of Black Gastroenterologists and Hepatologists. Can you tell us about this organization?
Yeah, so this organization came together in 2021. It started, I think, just with a text message discussion. I wasn't on the initial text, but I was eventually on the email. And one of the things about COVID is that it helped us connect with people. Mm-hmm. And so we're 11 board members. We're located across the nation, but Zoom brought us together because we were all on Zoom in 2020 and 2021. And so we were able to launch this organization officially February 2021. Now we have 370 members, from trainees to seasoned gastroenterologists.
Wow.
We had our first CME conference last spring. We actually also had a community event that we called Bust in a Gut, where I
remember clips. Yeah.
And actually Ed was one of the hosts with one of his friends, Dave Hellum, who's a comedian. I was one of the ABGH faculty on there as well with 3 or 4 other comedians. And we had, I think, 200 red community members coming out, asking questions about gut health. And so it's just really exciting that we've been able to do so much in educating our communities about GI health, colon cancer, liver disease, also mentoring trainees and students. We have a mentoring program as well. We do prep for fellowship, prep for interviews. And so it's just exciting, the work that we've been able to do. I think for me, what has been really nice is to finally not feel like the only one, and to have a community of people that when I go to a conference, I'm with my people now. Whereas before I was kind of lost in the thousands of people and I can't find the other Black people in GI. Now I know I'm going to see them and we're going to get together, and it's built relationships, and it's been amazing. And the feedback that we've gotten from members, from people who've come to events, has been overwhelmingly positive.
God, that is incredible. And I think one of the things I love about hosting this podcast is that these things are so attainable. If you look 5 years down the road, you're going to think, ASBH is this huge organization. It's like, no, it was started by 11 people
ABGH.
That cared. ABGH. You'll think ABGH is this huge organization, and it was started a couple years ago by 11 people that cared and put the work in, and now it's grown to 370 members. That's incredible.
Yeah.
So the work that you're doing and increasing diversity in the field of gastroenterology is commendable. How can folks get a hold of the organization?
blackandgastro.org. So they can join, they can donate, they can come to events, read about us. We have merchandise. We've got merch. So some sweatshirts, t-shirts. I have this colon cancer screening shirt that I wear every March. It says preventable, treatable, and beatable. And that's my March shirt. And so if you want to go and buy one of those just in time for colon cancer awareness, so check it out.
Perfect. We'll put a link in the show notes so we can support this incredible organization during the month of March, which is Colon Cancer Awareness Month.
Thank you.
As we wrap up, I do want to touch on one of the incredible things that you were able to do during the course of your career is the Commonwealth Fellowship. I know a couple of people that have done this program, and they all have done exceptionally well in life. They're like the people, I don't know, next president of the United States kind of caliber of person. So can you talk about this program and just what it means?
So it's the Commonwealth Fund Fellowship. It's out of Harvard Office of Diversity, Inclusion, and Community Partnership. And so this is a program, it's a fellowship that I did after my GI fellowship, but it's not only for GIs. People do it at all stages. It is for physicians, but some people do it right after their residency. Some people do it decades into their career. So that's just a great diversity of individuals in the program. And it's really geared towards training the next generation of leaders who are passionate about health equity, passionate about changing the face of medicine, improving healthcare delivery, and really approaching equity from each different angle. I think the beauty of this is that it's just so nice to have a network of like-minded individuals. And so I feel like we're all like equity warriors. And so when we have a conference or we get together, it's nice to have these kinds of conversations that we're all passionate about and that advance the narrative. As part of the program, I got my MPH from Harvard School of Public Health, and they also gave you a stipend in the program as well. So definitely super impactful. I would say it's changed my career and the direction of my career, and it helped me see medicine and where I fit into medicine a little bit outside of the box, and made me realize that I can shape my career in any way that I need to have the impact that I see myself having. And so for that, I think I'm forever grateful, and I would do it again in a second, given the opportunity.
That's awesome. It's a 1-year program or 2-year program?
It's a 1-year program, and we should actually also provide the link to that as well.
For sure.
Yeah. It's a 1-year program, and then you can get your MPH at Harvard School of Public Health or Master's in Public Policy at Harvard Kennedy School. So it's a great program.
I think with all of the information we have about burnout, there's so many people that got into medicine for reasons to help people, and now you're just kind of working away 9 to 5, putting in hours, doing peds, GI, whatever, and then you realize I really wanted to do more. And once you kind of have a clinical practice or wherever you are in life, realize that there are programs like this Commonwealth Fellowship. It's just one of several programs like it that you can go to, attend, and then potentially have a lot more meaning to your life and help people in different ways.
Absolutely. I feel like we all went into medicine because we wanted to have a certain impact. And so it allows you to not just feel like you're doing the everyday grind, but actually doing the work that is hopefully changing our society for the better. Hopefully.
Dr. Adjoa Anyane-Yeboa.
Nailed it.
Thank you so much for joining us on this show. I love to close by seeing what has inspired you recently, whether it's books, movies, film, conversations with patients or families. What's given you a burst of inspiration?
That is a great question. I feel worried that I can't think of something.
I'll go first. I'm reading a book somebody posted online. I'm not a big reader. By read, I mean Audible. Although I'm rethinking my subscriptions, but Audible is going to stay there for now. And the book I'm listening to now is Feel Good Productivity. And it talks about kind of how to be more productive, how to find joy in the things that you're doing, or even in mundane tasks, you can kind of make a little game out of it. And maybe I'm tired of going to work, but maybe I can see how many patients I can make smile today by saying something funny or witty or making them feel at ease, or it just talks about finding joy in the things that you do every day, no matter how boring or mundane they are. So It's a good book. I would recommend it.
I love that. For me, I guess I'll give a wellness tip. Does that count? Because I feel like that's the vibe that I got from your,
we could always use,
from your example. It's, and what helps me stay balanced is making time for the things that keep me balanced and make me feel sane and normal. And so actually one of my co-fellows in the Commonwealth Fellowship, we go to the gym together at 6 a.m. 3 days a week.
Oh, but my God.
I actually look forward to it because I know this is time for myself and that I'm going to have time to hang out with her. And so in finding meaning in the things that you do, don't forget to find time for the things that ground you and make you feel like you, and the people who make you feel like you, because that's going to enable you to be the best version of you, whether it's at work or in your personal life that you can be. So
I love that. These are the same day every week?
Different. You can sign up in advance. So I sign up for my classes every week. And then I actually sent her a screenshot just before this and say, sign up and let's be next to each other. We went this morning. It was great.
Yeah. How long have I been doing that?
About a year now.
Oh my God. All right.
About a year.
I need more structure. I need more structure in my life.
But it's finding the things you don't need. If you need this, I would say do it. It's helped me, but it's not for everybody. It's 6 a.m. is early, but it's just nice to have a community of people and a community to participate in something before I get to work. And that's the nice. It's like not only work, but there's other things going on.
I've noticed that, like, you move to a new spot for residency or whatever, and you're just seeing the same people because you're just going to work or going home. And then the second I find a church and I play on the worship team or bowling league, whatever it is.
Exactly.
Then that little extra community.
Exactly. It's not just that work bubble, but your life gets richer, whether it's church,
fantastic,
gym,
Love it. Well, thank you so much for joining us on the Black Doctors Podcast. We are here because representation matters.
Yeah. Thank you so much for having me. This was great.
Yeah. Welcome anytime. Thanks so much for tuning in this week on the Black Doctors Podcast. If you enjoy the content that we're bringing, please go ahead and share with somebody else that you think can learn from it and benefit from this. If you haven't already, leave us a review. I get those reviews and it does provide some encouragement, and know that this message, these vibes, this support, this community is working, it's growing, and definitely appreciate your support in that way. Reviews are free, drop some stars on us. We appreciate it. We're actually, growing to the point that we dip on and off of the top, I think it's 200 list of podcasts in the health and wellness space. So that's exciting. An email every week. It's like, oh, you were in the top 200, and usually not anymore. It's just like really fleeting, but we are growing. Thank you so much for your support in that. And then excited to, in a couple weeks, see you all at the Student National Medical Association. I think they may be kind of full in terms of registration, but I will be there debating, what kind of, you have to have a couple pins that I was handing out last time I was at the conference. I have some of those left that I'll bring with me, little representation matters pin, lapel pin. And so I'll be there. I'm going to be doing a poster judging. I'll be judging posters and then giving a talk or part of a panel for anesthesiology. So excited to see you all in New Orleans. Thanks for tuning in to Black Doctors Podcast. We're here because representation matters.